The U.S. Census predicts that by 2050, the Hispanic and Asian population will have both tripled, the Black population almost doubled, and the Caucasian will barely hold its own. The U.S. is rapidly becoming a more racially diverse culture. As nurses, we must be prepared to meet the needs of clients from various cultures and backgrounds. It's important for nurses to understand how culture affects behavior. Your competency for this unit is to adapt the nursing practice to meet the needs of the diverse patients in a variety of settings. Your learning objectives are listed here. Please familiarize yourselves with each of them. It's important to understand the meaning of culture. This is the values and beliefs learned and shared by a particular group of people. For example, in Western society, we consider the color white to be purity or clean, or an angel, a nurse. Chinese consider white to be the color of death. Physicians still wear white lab coats to symbolize this, but they wear dark clothes underneath to symbolize authority. Additionally, it's important to understand ethnocentrism, which is the tendency to view one's own culture as the correct standard to view other cultures by. This can lead to biases, prejudices, and stereotypes. Some cultural barriers to effective communication are especially challenging. There are 3 ways culture interferes with effective communication. The first is by cognitive constraints. Our worldviews may be different than others. The second is behavioral constraints. For example, standing close to someone or making direct eye contact can impose on what they view as acceptable. And third, emotional constraints. Regulation of emotion may be different depending on theirs. For example, the client may yell, wail, or act out or cry versus show stoic behaviors in a time of crisis or death. Culturally competent care in nursing. So to be culturally competent, the nurse needs to value diversity, be conscious of the dynamics that occur with the interaction, have some knowledge of the culture, and have adaptations in place to deliver competent care. Cultural awareness is when the nurse becomes sensitive to the values, beliefs, lifestyle, and practices of the patient or client, and they explore his or her own values, biases, and prejudices. Unless the nurse goes through this process in a conscious, deliberate, and reflective manner, there's always the risk of the nurse imposing his or her own cultural values on the encounter. So then, how do we provide culturally competent care? Access is a tool used to guide nursing practice. So for your assessment, think about the culture of your patient. What part of their beliefs or lifestyle may contribute to the disease? An example is the person with heart disease. What factors are modifiable? These are things such as diet, exercise, smoking, and stressors, versus those that are non-modifiable, such as gender, family history, and age. The goal then is to generate from patients information and understanding that enables the nurse to provide culturally congruent care. Do not ask a global question like, do you have any cultural practices we should know about? But instead ask specific questions about cultural practices such as meals, religious rituals, bathing, and herbal supplements. There are many cultural aspects to take into consideration when caring for patients. Patients from some cultures feel they deserve the pain due to wrongdoings committed by the patient. Also, some cultures allow warm foods or cold foods depending on the illness or health concern. It's always good to have a general idea of the culture of your patient, but be careful not to stereotype. Verify the cultural beliefs of your patient regarding health and illness. Don't just assume. The dominant American culture values assertive and direct communication. Other cultures value group harmony, respect to the elders, or other priorities. Remember, verbal communication can be different. Vocabulary, tone of voice, rhythm, speed, sharing of private information, these all vary depending on the culture. You may need an interpreter. And then also think about nonverbal communication differences such as touch, eye movement, facial expressions, body posture, and space orientation. So when assessing individuals from different cultures, it's important to remember that each individual is unique and cannot be stereotyped according to their culture. Fully assess what cultural beliefs they want to have incorporated into their care. Don't just assume. Also, look closely at your own views toward a particular culture and try very hard to remain neutral. So look at this case study and think about how you would respond to the questions at the bottom. Take a minute, pause this slide, and please send me an email outlining these 3 questions by Monday before class. This quiz is worth 5 points, and I'm doing this just to ensure that you have a good understanding of the cultural aspect of this presentation. So again, send me an email outlining these questions by Monday before class. So before assessing your patient, determine or observe their language, communication patterns, space orientation, verbal and nonverbal aspects, and roles. Potential nursing diagnoses include impaired verbal communication related to cultural differences, impaired social interaction related to sociocultural differences, noncompliance related to patient value system, and risk for loneliness related to social isolation. For the non-compliance one, though, make sure you ask yourself whose value system you're going with, the patient's or the RN's, when you determine the patient is non-compliant. Consider some ways to be culturally sensitive. With Somalians, the family is informed instead of the patient. Muslims believe that when a person is dying, their head must be turned in the direction of Allah, who's their God. Family members of the same sex clean and care for the body of the deceased. And for Muslims, the family reads the Quran. Some cultures believe the deceased body is to be buried intact. However, in the U.S., upon death, the family is asked about organ donation. It's a regulation. And this does affect how you care for your patients. And actually, I once cared for a Mexican migrant worker who was declared brain dead. And after speaking with his mother on the phone, she declined donation because she believed he had to be whole to go to heaven, and donation would have prevented that. So even though this is not my personal belief, I had to respect her beliefs. For a patient with a language barrier, provide an interpreter. Always use materials and teaching techniques that are culturally relevant for the patient and family. Cultural competence is best achieved when you are able to reflect on your own belief systems and avoid judging others based on your own experience. If you face a situation you're not comfortable with, it is okay and appropriate to discuss this with your supervisor or peers to work through it, or to request a different assignment if possible. This slide lists some other ways to increase cultural competence as well. So you have the ability to positively influence a patient's self-concept and body image, especially after significant changes, such as a mastectomy. Anticipate your reactions to unpleasant tasks and focus on the patient and not the task. An example of this would be caring for a patient with an ostomy. Be aware of common conditions and medications that can impact a patient's sexual health and use the therapeutic communication to open the discussion. Make your patient feel like what they're feeling is a normal feeling and encourage them to talk about it. So some therapeutic techniques you could use would be active listening, clarifying, and reflection, and then avoid making assumptions. Bottom line, if you feel you can't help the patient, find out what your available resources are. Perhaps a counselor on staff or a referral can be made. This slide just outlines a few legal principles involved in healthcare ethics, so it's a good idea to know what these are. Standards of care are pretty important. These are the expected level of performance or practice as established by guidelines, authority, or custom. If you're involved in a malpractice trial, the court will inform the jury about the standards of care. The jury then determines whether you acted the way a reasonable nurse would have acted in similar circumstances. In a court of law, this is described as what a prudent nurse would do. And the term reasonable nurse refers to the training that all nurses receive. Professional liability is covered by your employer, but this does not cover things that happen outside of work. So, liability insurance is relatively cheap, and for this reason, it is recommended that you get it. Patients do sue for compensation for a variety of things, such as medication errors, retained sponges, inappropriate delegation resulting in harm, and falls, among other things. Remember that the RN is still responsible and can be held liable for carrying out a physician order even if the order is not appropriate, but it causes harm. Stay current with continuing education and regulations. Have thorough and accurate documentation. Avoid pre-charting. And use thoughtful, accurate communication, which can all reduce the risk for litigation. Consent forms require special care. If you suspect the patient doesn't understand the procedure or the patient states that they have questions, notify the provider. The patient is never coaxed to sign, and it is not in the nurse's scope of practice to provide details of the procedure. As an example, I cared for a Hmong open heart surgery patient going into surgery, and the family wanted to talk to the surgeon first. The surgeon was upset with me that it was delaying surgery, but as a patient advocate, I would not let the patient go to surgery without the physician talking to the family first. Sometimes we have to stand up for our patients. Autonomy is the right of the patient to make decisions about their medical care without the provider trying to influence their decision. Patient autonomy does allow for the provider to educate the patient, but it does not allow for the provider to make the decision. And then down towards the bottom, DNR means do not resuscitate. Always know the code status of your patient and act accordingly. But remember, DNR does not mean do not treat. DNR patients can still have life-sustaining treatments such as IV fluids, vasopressors, and antibiotics. If you're unaware of the code status, you need to provide CPR until the code status can be verified. Community DNR bands are bracelets worn outside of the hospital that signify that the patient does not want CPR if they experience an out-of-hospital arrest. This requires a physician order and paperwork sent to the state. Good Samaritan Laws states that if you act within the standards and in your scope of practice, you are not held liable for a bad outcome unless there's evidence of gross negligence. Nurses are not required to render help, but it may be considered an ethical obligation. Once you're assisting, though, you must continue to assist until other qualified help arrives, such as EMS. And again, note that emergency assistance is not covered by an employer's malpractice insurance policy, but it would be covered by privately held malpractice insurance. And then a reminder of what HIPAA stands for, and that's the Health Insurance Portability and Accountability Act. So ethics in nursing are principles that serve as a basis for decision making. These are various ethical principles to be familiar with, so please take a few minutes and make sure that you can define each of these. The American Nurses Association sets the standard of care, which are considered guidelines for patient care. It's important to treat all patients with dignity and respect, regardless of why they're being seen. For example, imagine that a drunk driver is in the same unit as the patient that was struck by the driver and is on life support, not expected to survive. You have to treat both patients with compassion, respect, and dignity. And this was an actual example, and in this case, patients were moved to separate ends of the unit to decrease family conflict so that they did not have to be in the same waiting room together. The Ethics Committee gathers all information relevant to the case and considers possible courses of action and then decides on a course of action. In managed care, monetary incentives are often used to affect physician behavior and may include rewarding physicians who practice medicine frugally by offering financial rewards such as bonuses for those who provide the most cost-efficient care. If you think about it, this could be a pretty big conflict of interest. For end-of-life care, patients and their proxies should exercise control over decisions regarding the use of medical interventions that may prolong existence rather than to allow a natural progression of the dying process. The traditional value to preserve life by all possible means is now being weighed against patient-centered quality of life care. And it should be based on evidence-based care and a shared decision-making process. It's difficult when the treatment plan is prolonging death rather than saving lives. And this you'll probably encounter as a nurse, and it is an unfortunate thing that happens. An example of this would be resuscitation on a patient in a persistent vegetative state at the direction of the family, even though this patient is never going to get better and they're never going to regain their brain function back. Also, stay in tune with cultural sensitivity. In many cultures, health decisions are not made by an individual, but they're made by a group, the family, community, or society. The ethical principle of autonomy is related to self-determination, that is, the individual's right to make decisions for themselves. Consistent with this principle is respect for the autonomy of others. Therefore, the lack of respect for the decision-making of the culturally diverse people in nursing practice is unethical. An example of this would be Jehovah's Witnesses do not accept blood transfusions. And just know that providers can be sued for giving blood if the patient did not agree, even if it's to save the patient's life, because the patient has the right to decide what they want or what they don't want in their care. An important aspect of nursing is delegation. Delegating is a major element directing the everyday function of the nursing workflow. It's a competency by which RNs encourage and motivate others to get the job done. The legal and ethical implications that go along with delegation are pretty big, though. When delegation occurs, responsibility for the care is transferred to the delegate, but remember that accountability for the care remains with the delegator. So that means if you delegate to a CNA and they don't get back to you on something, you're still responsible for that. This is also an important part because the individual delegating an assignment has to be sure that they're delegating to people who are competent in the skills needed to complete the assignment. And not everybody will speak up and say they're not able to do that because they don't want you to think poorly of them. So just make sure that you're delegating the right task to the right person. And this concludes the presentation on diversity, culture, sexuality, and ethics. So just remember to go back to slide 11 and do the 3 questions at the bottom of that case study, and email it to me before Monday to get your credit for that quiz. Thanks and have a great day.